27. I'm Dean Obidala. Wednesday, August 26th. The big story today, we learned, and there's various big stories, but I think the one that's more significant for all of our healths is that we learned that Donald Trump is now getting the CDC to lie to us about COVID, to cover up Donald Trump's criminally negligent handling of the COVID virus that has taken almost 180,000 American lives in just 6 months. What we learned today, the CDC suddenly, without warning, changed their guidelines and when you should get tested. Before this, it said if you had been exposed to someone or suspected you were exposed to someone who had COVID-19, you should get tested. Now, out of the blue, the new thing is that people without symptoms, even if you're exposed to someone who's definitely sick, don't get tested. And doctors on every network, I don't watch Fox News, so on the real networks, CNN, MSNBC, were stunned. They were baffled. They have no idea what is going on there. Dr. Lena Wen, who's from George Washington University, said, these are the exact people who should get tested. You had Dr. Carlos Del Rio from Emory University School of Medicine, who said the evidence is that close to 40% of infections of COVID-19 are asymptomatic, and asymptomatic people transmit the infection. So of course you would, if you thought you were exposed to someone who was sick, or you knew you were exposed to someone who was sick, even if you don't have symptoms, you have to be tested because you could be a carrier. You could get loved ones in your house sick. You get people who've got pre-existing conditions. You could kill them. Literally, you could kill someone in your family or a coworker or a friend or someone you've never met. That's why you do this testing. Now, the CDC, when asked about it earlier in the day, said it's been updated based on current evidence, but they did not tell them what the current evidence was. Well, this afternoon, we learned what the evidence was. Dr. Donald Trump. That's right, Donald Trump, according to CNN reporting, and it's not been at all disputed, it says, according to CDC officials, quote, it's coming from the top down. That Donald Trump and the Trump administration told the CDC to change the guidelines. And why would they do that? Because Donald Trump told us over and over in June and July and repeated it. The more tests you have, the more confirmed cases, and that's bad headlines. Donald Trump in June at a rally literally said, I told my people, slow down the testing. In July, he repeated it over and over, saying testing gives, quote, fodder for fake news headlines. In Donald Trump's world that he's repeated, it's not news to anyone. He believes if you don't test, no one knows how many sick people there are. So the headlines are not bad for him. It's not good for our health because then you've got sick people walking around, people who are tested positive for COVID-19, getting others sick, killing people. But Trump doesn't want to know who they are because they're an inconvenient truth to his 2020 reelection campaign. Because everything is about Donald Trump. Donald Trump doesn't care if your family gets sick. He doesn't care if my family gets sick. He doesn't care if his most devout supporters get sick and some die. As long as it helps Donald Trump. That's who the man is. Today, Speaker Pelosi talked about very bluntly, we should be testing 300,000 people, 3 million a day. We should be doing 3 million tests a day. I had on an expert who used to be at the CDC who said very similar things. We should be testing 3 million people a day for a country our size to get control of this virus. What are we really testing? Well, and it gets even worse. In July, before Donald Trump's drumbeat of demands to stop testing around the country, we were testing about 1 million people, 900,000 plus. What are we down to now? 640,000 tested yesterday. Why is the testing dropped off? It's not that the deaths have dropped off. Yesterday, this doesn't get much press, yesterday, 1,200 fellow Americans died. There are now 1,200 families mourning in this country the loss of a loved one. 1,200, not 50, not 100, 1,200. By the time Trump gives his speech Thursday to accept the nomination, we will have likely crossed 180,000 Americans dead. And to say this was a virus around the world, there was nothing we can do about it, is not only wrong, it's a lie. It's a cover-up. Look at South Korea. South Korea, the same day that we had our first confirmed case, January 20th, of COVID-19, what did they do? Robust testing, contact tracing, finding out if people were sick. Who they exposed to, quarantining. How many people in South Korea, a country of 50 million, not 500, a country of 50 million, how many have died from COVID-19 in these 6 months? A little over 300. 300. Canada, only about 9,000 have died. America, we'll have 180,000 probably before the day is over. That's what we have. And just yesterday, we had nearly 40,000 positive cases of COVID-19. 40,000. What do they have in South Korea yesterday? About 280. This is where we are, my friends. Our nation could do better. Donald Trump is gaslighting the country through lies and incompetence. And now he has the CDC helping him. And I've made the case on my show before with some really great guests like former prosecutor Glenn Kirshner. And I believe this in my heart. Donald Trump must be charged with manslaughter for intentionally misleading the American people. And now it appears slowing down the testing to help his reelection. All of this is to help Trump at the expense of our health and your family's health. That is Donald Trump. Our nation cannot afford 4 more years. Our health cannot afford 4 more years. So that and more in my show tonight, Sirius XM channel 127, 6 to 9 p.m. Eastern time. I hope you'll check it out. Thanks for tuning in to a little preview of the top issue of the day for today's DW Dollar Show.